Now we're going to move into the things that bite. And the first thing that we're going to talk about is spiders. And unfortunately, most people are tremendously afraid of spiders. And spiders are just pretty much everywhere. So things to note are there are many species of spiders, but only 2 different spiders in the United States actually can deliver serious venom that is going to A, penetrate into the body, and B, cause any kind of tissue necrosis. And so your safety is extremely important, and we want you to understand what you're dealing with and what your risk factors are, both as a provider or a patient. So obviously the first one we're going to talk about is the ever impressive black widow. And the black widows are fairly large, typically about the size of a thumbnail, and with their legs outspread can measure about 2 inches long. They're black in coloration, and they have a bright red-orange kind of hourglass shape on the abdomen. This is the female of the species, which is the only one that can actually deliver the bite. And the male is usually kind of drab looking and much smaller in nature, which the female will often kill and eat after they've mated. Black widow spiders are found in every state so far except for Alaska. They prefer dry and poorly lit or dark places. The bite is often not initially felt and sometimes overlooked. And then the symptoms are what cause us to kind of think about what may have happened. And so usually a lot of people will get bit by like reaching into something where there's clutter or perhaps maybe a wood pile, and you know, they kind of provoke the spider to go into a defensive bite mechanism, and you know, you might just kind of feel something that didn't really hurt necessarily, but is not that comfortable, and you kind of just go about your business. And then later on we start to have really bad muscle spasming and some abdominal cramping and other symptoms very similar to that. These will generally subside in about 48 hours. The treatments are basically BLS for anybody that's in respiratory distress. You're going to clean the bite with soap and water and apply an ice pack to the area. There are some medications that can be given for black widow spider bites, and now the evidence is kind of coming back that maybe some of these medications aren't nearly as effective as we initially thought, and the only one that is allowed to give some of these medications is the paramedic provider, so we won't dive into that. We would be remiss if we did not speak about the brown recluse, and as much as I love to hear about how everybody I know has been bitten by a brown recluse, in our particular area there are no actual known brown recluse to reside other than the very eastern portion of our state. There are 12 different recluse species throughout the United States, and there are some that live in our particular area, but they are not the true out and out brown recluse. There's the Apache recluse that kind of shares some of the surrounding area with the brown recluse. Regardless, the recluse is actually not very aggressive. They may bite if provoked or left no choice, but for the most part, this is a very kind of shy species of spider, and one of the telltale ways to know whether or not you actually have a recluse species or not is to, if you can trap it or you see it after you've been bitten, is to look at its eyes. And if you're looking at this picture, it's really hard to see, but there are 3 dots. And that is the telltale sign for a recluse, is that they have 6 eyes, which is 3 pairs of 2, whereas all other species of spider have 4 pairs of 2 for 8 eyes. Now, again, brown recluse or recluse in general tend to live in dark areas. Their venom is cytotoxic, meaning that it causes tissue damage, and this is where when you do see somebody who's actually gotten a pretty good bite from a recluse species and they've not kept up with it or been able to maintain, you can see really severe tissue damage. A lot of this is initially from the recluse venom, and then the secondary damage generally becomes part of the bacterial invasion from the open wound. And so we're going to look at a couple of pictures, and you're going to see how something goes from a small kind of superficial wound to a full out large wound that may need to have surgical excising done to remove the dead tissue. So here we've got it. That to me looks like a pretty significant bite, and it's got an ulceration there, and you can see it becomes swollen and tender. There's a pale mottled cyanotic center, and then this looks like there was a blister there, and now it's got kind of missing tissue in the very center. And these patients, you're just going to treat them like they have any other soft tissue injury. You may give them ice, you may give them something for pain, and you're going to just transport them to the ED to be evaluated. Now, if we're looking at this where we have the progression, so we've got a gentleman who was bit on the thumb, and you can see the swelling and the discoloration at day 3. At day 5, the swelling has increased exponentially. By day 6, it is now showing you tissue necrosis where the bite was. And then at day 10, you can see all of the dead tissue, which has had to have been sewn back closed to try to keep things from exposing tendons and other things like that. These are people that, again, not necessarily purely due to the cytotoxin, but this is probably more a bacterial problem from where the initial injury was presented and it just became infected. Other things that sting and bite are bees, wasps, ants, and yellow jackets. And I myself don't like any of them, but I can tolerate honeybees. They generally tend to leave you alone. I absolutely am not a big fan of having flying, stinging objects near me. I just try to remain calm. The good thing is that I do not have an anaphylactic reaction. There is a large population that can have anaphylactic reactions if they're stung and they're allergic to that venom. So these patients generally know that they have an allergy to bee stings, and they will usually be carrying an EpiPen, or they will let you know immediately that they have anaphylactic reactions to bee stings. Again, honeybees are the only flying bee type insect that is going to actually leave the stinger in the skin. And when that stinger, the barb catches the skin and it pulls its internal organs out, there is a venom sac that is still continuously pumping, leaving even more of the venom inside the victim. We want to make sure that we never use tweezers to pull these off, because we can actually create even more of a problem by squeezing more venom through the hollow stinger barb. And so we're going to use a credit card and we're going to scrape the stinger and the sac off the skin. If your patient is known to have an anaphylactic reaction to bee stings, or you see one starting to begin, and this is again you guys should treat this aggressively. If you start to see wheezes coming about and then extensive urticaria, or if they're developing any kind of hypotension and any angioedema, which is the swelling around the mouth and the lips and in the tongue. And so Epi is your best friend in this one. Do not be afraid to use Epi. It's 0.3 milligrams of 1-to-1 Epi in an IM and injection. And then we're going to use this because this is going to attack the problem from both sides. We're going to cause bronchodilation and vasoconstriction, which is going to open up that airway and clamp down the vessels so that we can kind of drive away the urticaria and bring the blood pressure back up. And then after we've done that, we're going to treat this with long-standing antihistamines, which is your Benadryl, and then you can get into your corticosteroids of Solumedrol or dexamethasone, whatever is approved in your particular area. So now we're going to move into snake bites, and we're going to talk about those. It says 5 million snake bites occur annually worldwide. That's a really significant number, and I have no idea if that's just wild snake bites or if this is snake bites by people that own reptiles. In the United States, there's 115 different species of snakes, and only 19 of those species are venomous. And as a reptile owner myself, I can tell you that snakes generally do not want to bite unless they're provoked, and they're trying to elicit some kind of situation where they want you to release them. Most snake bites occur between April and October, and that's because the general North American continent is, for the most part, too cool for reptiles in the winter, so most will go into hibernation, and as they come out, they are very active. And as the slide says, the people generally who are involved in snake bites are young men who have been drinking alcohol, which is a double compounding risk factor for making poor choices. Use extreme caution on these calls, which means that generally you may be called out to a remote location and there may be more snakes in the area. So you want to make sure that you have good higher up boots and long pants, and be aware of your situation and your surroundings. Now, for the most part, most venomous snakes in the North American continent are pit vipers. They have triangular or diamond-shaped heads. They have small pits just behind the nostrils and in front of each eye, which are heat-sensing organs. And all of these snakes will have a vertical cat eye-like pupil. If you see a snake that has a round pupil, that is typically a misidentified snake. If you think that it's poisonous or venomous, it's actually usually a rat snake or something along those species. Now here are the pit vipers, the rattlesnakes, cottonmouths, water moccasins, and copperheads. And all of these snakes have a general appearance similar in nature as far as body structure. They have a little variation in coloration, but if you look at them, there tends to be a very similar pattern in the way that they are built and the kind of habitat that they're going to encompass and their hunting patterns. When we're talking about the western diamondback, this is the most prevalent venomous snake in the Southwest, and you can see it has a pretty extensive range which covers the vast majority of New Mexico, huge portions of Texas, a little bit of Arizona, and the very southern end of California. Again, here's that diagram of eyes in regards to venomous versus non-venomous. Generally, if you're not great at identifying a snake, you should probably not be trying to identify it. If you're not a reptile fan, the best course of action is to just give them birth. Like, let them have their way. For the most part, snakes want nothing to do with you, much as most people want nothing to do with them. And if you just give them enough space, they'll go do something else instead of trying to attack you, which generally their bites are, again, mostly defensive in nature. Here's a pretty good example of a rattlesnake bite, and you can see that there's a lot of tissue necrosis there, right? And the body is blistering and kind of bleeding, and all various sorts of damage is happening as it's kind of coming up the arm. Some of the signs of an envenomated bite are going to be severe burning pain at the site of the injury. There's going to be swelling and bluish discoloration, weakness, nausea, vision problems, sweating, fainting, and shock. And this really depends on the type of venom that the snake is able to inject. It could be some kind of neurotoxin or obviously the cytotoxin. In regards to treatment for snake bites, keeping the patient calm is probably the best course of action. Keep them still, splint them if you can keep them from moving it. Every time the patient moves that extremity, they're helping to push the venom into the bloodstream even quicker and move it across the body. If they're extremely agitated, they're going to have a higher heart rate, and this is going to help kind of spread that venom even quicker. So the venom is going to be spread through the lymphatic system, which, if you guys remember when we went through Aemt, this is mostly controlled by osmotic pressure and muscle movement, which is going to help create fluid shift in the body to where we get things into the lymph nodes and the lymphatic system for excretion. If you can find the bite, just kind of identify it, and then if it needs to be cleaned, you're going to wipe it very gently with some normal saline. If it's a bite on the arm or leg, you may consider the use of a pressure bandage, but always check with your local protocol, and this is going to be based obviously on the type of bite and what the physicians or the treating physicians would prefer that you do. Make sure that you're watching your patient's mentation. If they're going to get a decreased mentation or they are at risk for vomiting, they are also at risk for aspirating. So do not give them anything by mouth, and make sure that if they are going to vomit, you can clear the airway or use suction immediately. Now, there is a small snake that is called the coral snake. Does not have fangs. It is a normal or a kind of like a fish hook shaped toothed snake. They are often confused with milk snakes and other rat snakes just due to the mimicking of those particular species, trying to utilize the coral snake's coloration to give themselves a defense mechanism. The coral snake lives in the southeast primarily, but there is a southwestern coral snake that lives in northern Mexico and southern Arizona. The coral snake's venom is neurotoxic, and this is different than the typical pit viper, which would be cytotoxic. If a significant bite is received by a patient, will cause paralysis, and there is a saying that if you see something that is red on yellow, it will kill a fellow, and then if it is red on black, venom lack. And this is how, for the most part, you're going to differentiate between a coral snake and the typical king or milk snake. And as you can see in this particular picture, you can see that the coloration kind of varies a little bit, and not everything is cleanly defined or well planned out. So make sure that if you're looking at this and you're trying to identify, you are being very careful, and understand that for the most part, if you don't have to mess with it, you should probably not mess with it. In today's day and age where we can take cell phone pictures of most anything, that would probably be your best bet, is to just utilize a picture of the offending snake, unless obviously the snake was killed in the process. You can then transport it back with your patient. This is that Sonoran coral snake, which again lives in Mexico and South Arizona. It could often be confused with the Arizona mountain king snake, which has that red, black, and yellowish color, or red, black, and white banding that very often mimics that coral snake. Now, a bite from a coral snake will give the signs and symptoms of slurred speech, dilated pupils, a kind of paralysis, and then ultimately will lead to respiratory arrest and then death. The treatment is to keep the patient calm and then get them to treatment as quickly as possible. In the event that it's a misidentification, the patient may be bitten by, again, that milk snake or a king snake, in which case there will be no symptoms at all. It's very rare for them to break the skin, and if they do break the skin, it's a very mild irritation that just needs some soap and water to clean up the injury. Because these coral snakes actually do not have fangs, they're going to inject their venom with teeth with a chewing motion. And again, this is why, for the most part, these snakes don't have a whole lot of ability to inject a lot of venom into the body, because your natural reaction is going to be to pull away or get the offending snake off of you. The neurotoxin can create some really bizarre behavior within a few hours, and again, the progressive paralysis ultimately ending up with a respiratory paralysis, which is going to cause the cardiac arrest. Because the coral snake bites are actually fairly rare, most hospitals do not stock this, and so if you again have a dead specimen that from the interaction, that is appropriate to bring it with. Otherwise, make sure you take a really good picture of it and try to use that to help identify the snake bite if you can get them to the appropriate facility quickly. If you see a bite, you want to circle the bite mark as this picture shows you, and then you're going to document times. And so you can see that there's a set of fang marks in this gentleman's hand, and they've circled the site of injury, and then there's a small number there. It looks like it says 3 o'clock written on there, so that it shows that. And as this progresses, you're going to lightly trace the circle of inflammation and then write the next corresponding timeline, so that the physician who's receiving this can see how quickly this is spreading through the body and how quickly the tissue damage is coming into place. Now we're going to move into the Southwest favorite creature, which is the scorpion. And scorpions are belonging to the arachnid family with spiders. They have a venom gland and a stinger at the base of their tail. They are relatively rare to come into contact with. They're pretty reclusive, and they live in dark, kind of unkept places. They are insect hunters and generally do not want to sting you. A scorpion sting is considered to be very painful, but it's usually not very dangerous. Now, one of the exceptions for a dangerous scorpion bite is the Arizona bark scorpion, and this venom can produce a severe systemic reaction, which will cause circulatory collapse, severe muscle contractions, excessive salivation, hypertension, seizures, and cardiac failure. Now we're going to move into the tick, and the tick is nationwide. It's found in any kind of heavy vegetation, and its typical prey animal is a wild animal, and they will ultimately end up attacking you if you disturb the brush or any of the other things that are around. They are sensing heat and carbon dioxide to find their target prey, which doesn't necessarily need to be a rabbit or a deer. If you are there, you are a perfect host for giving them the nutrition that they're looking for, which is feeding directly on the blood supply. The problem with ticks is that ticks carry microorganisms in their saliva, which cause many other diseases. So we're going to kind of dive into these diseases, and the first one is Rocky Mountain spotted fever. It occurs 7 to 10 days after a bite. The symptoms include nausea, vomiting, headache, weakness, and paralysis. Then we can go into Lyme disease, which is a little bit more kind of known. as far as actually seeing the symptomology and understanding what created it. And the first symptom is a rash that spreads to several parts of the body, and it begins about 3 days after the bite. It may resemble a target or a bullseye, and there is some swelling and pain at the joints. Again, tick bites occur mostly during the summer months, and that's because when people are out in the nature or wildness, they are going to put themselves in the direct contact with any of the brush that has some kind of tick infestation. And while I'm unsure what this transmission from tick to person says taking 12 hours, I'm assuming it's just kind of alluding to the fact that ticks are an insect that will attach and kind of burrow their head into the flesh so that they can feed. And this can generally last up to about 12 hours before they'll dislodge themselves. Now what this is saying is do not attempt to suffocate or burn the tick. And if you can save the tick for identification, it's probably best. Although after the bite has already been inflicted, the damage is done. We're going to roughly go into the marine animals. This is going to go back to your immersion type accidents where people are diving. And this is the jellyfish, the Portuguese man-of-war. All of these can inject venom through their tentacles or barbs. And these are very painful reddish lesions that are typically found on light-skinned individuals. It can cause headaches, dizziness, muscle cramps, vomiting, and fainting. Okay, so if you get the pleasure of treating a sting from a jellyfish, Portuguese man-of-war, or an anemone, the coral or various hydras, is to remove the patient from the water, and then apparently you're going to wash the affected area with vinegar, trying to neutralize the toxin. And then you're going to do that for about 30 seconds. And then if there are any tentacles left over, you're going to try to scrape them off with a sharp, stiff object. As you stimulate that leftover kind of tentacle, it will probably still be trying to inject venom into the skin. So we want to do that quickly and very dedicated motions. If you're going to treat toxins from the spines of urchins, stingrays, or other spiny fish, you want to immobilize the affected area and soak in hot water for 30 minutes and then transport your patient. Okay, so that concludes our lecture on any of the various environmental exposures or attacks from random, very rare things. And as always, if there are any questions that we can expand on, please do send me an email, or let's bring this up in lab so that we can create a class discussion. All of us can actually brush up a little bit more on this, and even myself. A lot of these subjects I am not very well versed on because it's not something that we're doing on a regular basis. Again, if you find a mild fascination with any of these things, I encourage you to seek out the appropriate additional training or information so that you can become part of one of those response teams.